Hi everyone. So I think we'll get started. It's 12:02. Um, so today we have Shannon Majowicz. Sorry if I mispronounced your last name.
It was
Here
perfect.
with us today online to present about can eating be a risk-free activity? Conceptualizing public health or public policy initiatives aimed at improving food-related health outcomes. I wanted to welcome everyone online as well as in the room today to join today's seminar session. So with that, I'll pass it to Shannon to start her presentation. Thank you, Shannon.
Perfect. Thank you so much. And thank you everyone for your time and attention this afternoon. Just a bit of housekeeping. I'm going to actually mute the teleconference line right now. So for those of you that are on the teleconference, you'll be on mute, and I'll unmute you at the end for the questions. And for everyone, I'd ask actually that if we save the questions to the end, that would be great. So I'll do that right now. The conference is in lecture mode. Perfect. So again, thanks so much for your time this afternoon, and it's my pleasure really to be here today on behalf of a very diverse team that we've pulled together here at the University of Waterloo. We've got the names listed down for you, and these folks represent expertise in food safety, food security, poverty, trust in the food system, toxicological contamination of food, obesity, nutrition, and allergy. I'd actually like to do two things before I begin the presentation proper. I'd like to give you an introduction to who I am and orient you to who this disembodied voice on the phone is. And while I'm doing that, I'd actually like to ask you all to do something for me, and that is to note down some of the current policies or programs or decisions or issues that you might have on your plate or on your to-do list right now in the area of food and health, in particular related to public health practice, because I'd like to come back to that at the end. So I'm a foodborne disease epidemiologist by training, and I spent about 10 years at Health Canada and then the Public Health Agency of Canada before joining the University of Waterloo in 2012 as an assistant professor. And there we go, press the right button to move through. So now on slide 2, for those of you who aren't aware of where Waterloo is, we sit about an hour west of Toronto. And I'm joining you today from this lovely building here. I'm actually right behind that pine tree, sitting here in snowy Waterloo. And perhaps so that you can put a face to the voice that you're hearing. This is me in my office just before logging on today to talk to you. So now you have a voice to put with, or a face to put with a voice. So to get started on slide 5, for those who are following along on the phone, in terms of the background for the project I'd like to talk about today, it started really with some high-level thinking around what we eat. And as a foodborne disease epidemiologist, I was very interested in the topic. And as someone who married into a farm family, I was also very interested in the topic. And of course, what we eat, and whether we're thinking about this individually or collectively, our diet is influenced by a very complex web of factors. And these drivers can be individual level drivers like our culture and our preference and what we have a taste for. And it can be drivers at other levels as well, including environmental drivers, factors related to our built or natural environments, societal drivers ranging from politics and legislation and socioeconomic factors, etc. And it really, to me, is at the point of consumption, so at the point where the food is passing our lips, that the relative impacts of all of these different factors and forces almost come together and integrate quite fully, and at that point can then jointly impact our health, for better or for worse. And this actually became really apparent to me when I joined Waterloo, because I was the lone foodborne disease person in an institution and in a school of public health that really had strengths in the non-infectious side of food and health, so strengths in allergy, in nutrition, obesity, etc. And I started to think about food safety and foodborne disease in the context of these other food health outcomes, And when we talked to folks about what they were doing and the kinds of interventions, for example, that they might be researching, it seemed as though we might actually be connecting inadvertently in ways that we might not have expected. And so on the next slide, slide 6, for those following along, it became apparent that things that might be beneficial from my perspective as a food safety, foodborne disease person, messages perhaps around produce that you might want to avoid because it's involved in an outbreak, might have inadvertent negative consequences in other areas. So organic food, for example, might have less man-made chemicals on it, but I suspect it also has a higher level of fecal contamination, potential fecal contamination from manure. And of course, the kind of contrast or tension such as this isn't limited to things related to food safety and foodborne disease. There's impacts around what we message around foods to avoid related to outbreaks, and how does that compare to what we're also messaging around foods to eat to maintain proper levels of nutrients. The issue of pesticides in foods also has implications for food security. So now we have kind of chemical contamination linking in or potentially in tension with food security issues. And that happens in multiple ways. I'm now on slide 9, where you can see that issues around wanting to have local food production for food security purposes, for example, could have potential negative consequences for the kinds of toxicants that you might be exposed to. And of course, I could go further, but the slide was getting full. You look at messages around the kinds of foods, again, to eat for nutritional purposes, and how does that relate to what we're trying to do with respect to minimizing exposure to allergens in different contexts. And so to me, this started me thinking / worrying about this question of whether eating could actually ever be a zero risk activity. So could we reasonably expect, a diet, whether for ourselves or for the population that might be in our jurisdiction, that is, completely free of foodborne pathogens, non-obesogenic, non-allergenic, free of chemical contamination, that is sustainable, that is secure, that is culturally appropriate, etc. And I think, now on slide 11, that when we're making decisions about these kinds of factors and we're weighing the pros and cons at the individual level, so whether that's for ourselves or for our families, for example, that it is a bit of an easier task. We can think about our own risk factors and our own exposures and our own values and make some decisions about what might be an acceptable risk versus what might be an unacceptable risk for ourselves. But I think it gets particularly thorny when we have to start to make those kinds of decisions at the population level. Now on slide 12. So how do we choose which risks are the ones that we want to mitigate and which risks are the ones that we might be able to live with? And if we are seeing that some of our health consequences and the things that we do to mitigate negative health consequences might be in tension with each other, how do we start to decide which ones take precedence? And of course, I don't have an answer to that question. But in thinking about that and coming from the background that I come from, it really did get me thinking, and then with this research team get us thinking about what does this mean for what we actually do around food and health in Canada, and in particular, what does it mean for how we do public health practice related to food? How do we balance these different conflicting risks? And is there a way that we could take some of this thinking, which can tend to be sort of a little high level and philosophical, and to be frank, when I talk about this idea with folks, rarely do people disagree that these things are all interrelated. But the challenge that I hear is, great, it's all interrelated, but what do we do about it, right? How do we take this kind of more systemic way of thinking about things and translate that into what we do when we get into the office and sit down Monday morning, 9 o'clock at the computer? So now on to slide 14. This leads me to the project that I'd like to talk about today, which is a pilot project that we started in the summer. And it's really a conceptual project that's attempting to address this issue of the intersections between these different sort of food health issues. And we've specifically decided to take a systems approach, so applying a systems lens to look at the intersections between how public health efforts, or population health efforts as it were, in the areas of food safety, food security, allergy, etc., can intersect either in ways that perhaps are obvious or in ways that are maybe not so obvious. So that's our overall objective. So now on slide 15, when we were thinking about this application of a systems lens, what we were really leaning toward was aiming to reveal the underlying structure of the factors and their interrelationships that have bearing on these issues. And so I'm calling these factors drivers. So part of what we wanted to do is to explore, are there shared drivers of these issues? And these drivers could be sort of very proximate causes, or they might be more distal factors that are associated through a sort of longer pathway. And that we wanted to explore not only are there shared drivers, but if there are, does that mean that there's the potential for some of our public policies to have either synergistic or antagonistic interactions? Could they be accidentally or inadvertently working together in ways that we didn't intend? Or, I think in some ways more concerning, working at cross purposes to each other? And similar to that, our sort of third thought was, again, if there are drivers that are common among these issues, what would that mean for a particular policy aimed at a particular issue to have unintended consequences in a different domain area? So for example, could what we're doing around food safety to try to really minimize foodborne disease in Canadians, for example, accidentally be causing issues in the area of food security or allergy or obesity? So that was the intent of the systems approach. On to slide 16, our specific objectives were really twofold. One, we wanted to model these shared drivers, and we narrowed our list of food health issues down to 5 issues that we felt that we had internal expertise for, and I've listed them here. And we also picked these ones because we felt that they were important issues for Canadians, and also that we hypothesized that they likely had shared drivers. Not necessarily that there would be drivers common to all 5, but that there would be drivers common to at least 2 or more of these particular issues. And at the moment, we're currently working through this modeling process, and that's what I'll present some preliminary results on. Once we do that, what we'd like to do is take that model that we develop and apply it to about 2 or 3 specific public health policies or actions, and illustrate how there is this potential for synergism or antagonism between policies, and if possible, maybe sort of hypothesize or have an educated guess as to what some of the unintended consequences might be. I would also like to note at this point that one of the things I'd like to do in the question period at the end is hear from you as to whether there are particular policies that you might recommend that we do in this sort of second phase of the project. So I'll put that idea out there. So moving on to slide 17. With respect to the first objective, to model these shared drivers, what we decided to do was to search the peer-reviewed literature and to look for two kinds of papers, either review papers that gave an overview of the kinds of contributing factors to some of these health outcomes or these health issues, or also to look for papers where they might have started to think through the broader causal diagrams underlying these issues. So for example, the variables that contribute to production of obesity. And we recognize that what we're proposing to do, or what we're doing here, is not going to yield, the most perfectly exhaustive and comprehensive diagram. Fully recognize that we will have factors that are causal factors that are not captured, but rather the goal for this is to generate a model that has enough breadth to illustrate the potential for connectivity between these issues. So to do this, to get from the peer-reviewed literature that we're finding to this model, we actually ended up coming up with the following set of methods as a way to sort of triangulate what we're doing. So unlike a sort of systematic review type approach, the kinds of things that we're finding in the literature are much more qualitative, and we're seeing a real variety in the detail and kinds of evidence that exist. So for some papers, there will be a very detailed, beautifully laid out causal diagram. In other papers, which are a more traditional narrative review, the author discusses 10 different factors, but perhaps doesn't link them together very explicitly. And so to be able to systematically extract that information and pull it together in a final model has been a very interesting challenge. And so our approach is going to be threefold, or is threefold, I should say. The first is that we're doing an automatic text analysis of the articles. So by that I mean we'll take all of the articles that we identify in a given area, we'll say food safety, and we'll extract out automatically the frequency of different words in those articles and use that to summarize the kinds of factors that are being mentioned most frequently. The other thing that we're going to do is take the existing causal diagrams that have already been published in the literature and actually merge them together into a single causal diagram. And then finally, the third thing that we're going to do is have the experts in each of the domain areas review the literature, and then based on their assessment of the material, create a causal diagram for the particular health outcome. So food safety, for example, or food security. So that's currently ongoing, and the plan after that's done is to take those images, those models, and merge them together into an overarching causal diagram. And to do that, what we're doing is basically identifying the kinds of identifying the drivers that are common to two or more of the outcomes, and then including those in our final model. So again, the final model won't contain all the causes. It will focus on the ones that are common between these different outcomes. And I will reiterate that we're using the term cause and the term causal diagram quite loosely. So fully recognizing that some of the things we capture are not direct causes, but factors that have influence on the outcome in a variety of different ways. So on to slide 18 now. In the summer, we did a preliminary assessment of the causal diagrams for foodborne disease, food security, obesity, and allergy. And we did this to determine whether there was enough sort of interconnectivity between some of these outcomes to make this effort worthwhile, and also to get a sense of the level and type of evidence in the literature. And in doing this, we found 31 causal diagrams, again, sort of more loosely defined. And interestingly, the literature focused primarily on obesity and food security, the literature that had these causal diagrams in it. And there were very few published causal diagrams in the area of food allergy and foodborne disease. And a observation, I guess, made from this process was that the causal diagrams tended to be published for those topics where a biological understanding of causality was either, very, very complex, there's multifactorial causes, or where there wasn't, one particular organism, for example, with respect to foodborne disease that could lead to an outcome. The kinds of factors that we identified from this process were really wide-ranging. So we identified drivers regardless of the scale that they operated at. So they could have been individual drivers, they could have been societal level drivers. And they really ranged across physiological factors, all the way up to sort of widespread social influences, environmental factors, both built and natural, economic factors, etc. And when we took these causal diagrams and these list of common drivers and put them together, this is what we came up with. So we're on slide 19 now, and I'll just take a moment to let you look at that. So our first observation from the production of this model, as it were, was that it was really complicated, very hard to understand, and actually that there was a little bit more interconnectivity between the outcomes than we even expected. So it confirmed for us that our effort was going to be a worthwhile one in being able to show the interconnectivity between these different food health issues. You can see again that the kinds of things that were identified really range with respect to scale, all the way from individual genetics and their link to obesity to the role of climate change and food security, and then indirectly with foodborne disease through the potential for microbial contamination. Again, this isn't an exhaustive picture of all the possible causes, but I think it illustrates why it might be worth starting to think about the impacts for what we do in one domain area on another. So on to slide 20 then. So as mentioned, we're using a triangulated approach to identify the drivers and extract them from the literature, and that's currently ongoing. We'll be pulling all of that together in an overarching model using a group model building process at a sort of an expert consultation meeting, where we'll take the individual diagrams developed for each of the 5 food health issues and pull them together. And I think you've probably noticed at this point that I'm using the word model in, well, at least for me as a quantitative epidemiologist, in a very non-traditional sense. So, originally setting out, we had, some small hope that perhaps there might be some actual numeric values that we could apply to each of the relationships between each of the factors. We could talk about maybe how associated they were, but we're sort of heaps away from being able to do that. So the model is really quite conceptual, but I think what it does allow is to follow the pathways of factors that connect issues in ways that we might not have expected. Once we have that final model, the plan is to apply it to some kind of public health policy example. And I'll say policy, but it might not be necessarily an actual sort of policy being prepared. Perhaps it's more a public health practice issue. The specific examples that we're going to use are still to be determined. We've had a few suggested in a variety of different fora, including salt reduction and backyard chickens. Those were the two that have come up so far. And when we do this, we'll be looking to identify ways that these policies might accidentally work at cross purposes to one another or might come together in a synergistic way. Also, whether they have any quote unquote unanticipated impacts. And part of what we're doing here as well is to be able to lay out some of the benefits and challenges of taking a more transdisciplinary approach when we're making decisions about populations and the protection of health as related to food. Again, you know, my ideal, my long-term goal is that we would be able to actually model some of the potential intended and unintended consequences of policy actions. I've got the quantitative models option in brackets because I think we're still both quite far away from being able to do that with respect to the information we have available. But I'm also not entirely sure it would be appropriate to do because of the level of uncertainty around some of these relationships. And so I think what we'll be looking at doing is something much more narrative-based, where we could descriptively talk about how a policy might ripple through that system and create outcomes in other areas that we don't normally think about. So on to slide 21. There was something else that we noticed when starting to apply this sort of systems lens to this particular set of issues, and that was how the systems perspective related to what we knew about public health practice. And so when you look at the systems literature, there's some important points to note. And I've got them listed here. So the first is that the system is complex, and it will remain complex, even if we choose to ignore the complexity. And that the system produces the behavior it's designed to produce. So the factors that exist and the ways that they relate will produce a particular behavior. And in the context of this project, that behavior is a health outcome in a population. So there is a set of factors, and the way that they interrelate produces the level of foodborne disease, for example, in the Canadian population. And that if we want to change that outcome or that behavior, we have to change that underlying system structure. The other thing that we can gain from the systems literature is this idea that optimizing the behavior of the system as a whole may mean that at some points within the system, we're at suboptimum conditions. So it makes me wonder if optimizing a healthy diet for Canadians as a whole means that we might have to accept some suboptimal levels of some of these food-related health outcomes. So does that mean we have to accept some level of foodborne disease in Canada to be able to have the healthiest diet possible? And I don't know what the answer to that is. A few other points to note, I guess, related to the systems perspective, are that if we want to make sustainable change, we really need to use multi-pronged, multi-partner approaches. And I think, you know, public health does that quite well. But we also might consider changing our focus from attribution to adaptation. And that, again, from a systems perspective, redundancy within the system is actually a strength. And when I contrast these learnings with my own experience in the federal government for about 10 years, it's actually, it's an interesting contrast. So with respect to public health practice, again, speaking from my own personal experience, it doesn't matter that the system is complex, but the media and the public and policymakers often want a simple message, right? And we referred to this as the 3 bullet point solution. So what are those 3 bullet points that go in the briefing note, for example? The other thing that happens is this systems image, that spaghetti diagram of complexity, can actually produce despair in people who might be able to take action to try and make change, to the point where folks have said, okay, that's great, but what the heck do I do? How can I ever influence this complexity? Another issue is that evidence-informed decision-making, which is a really excellent thing, typically values evidence that's clear, and also typically values evidence that shows a linear cause-effect, right? So if we do X, then Y will happen. And the stronger that evidence is, the better. But producing that kind of evidence from the systems image is going to be quite a challenge. A few other things with respect to public health practice, in contrast perhaps to a systems perspective, is that when we weigh different courses of action, certainty of outcomes is valued. And quite frankly, as a Canadian taxpayer, I think that's a good thing. And this links with the last point that, particularly in this day and age with reduced resources, that prudent use of public funds really supports minimizing redundancy, minimizing uncertainty, and not taking on risky ventures that might fail. So again, I'm not coming today with any sort of solution to this schism, but it's interesting to note that the kinds of things and the kinds of challenges I think people face in the practice of public health can be at odds with what the systems literature is telling us might be, I don't want to say the best course of action, but might be the kinds of things we want to consider. And how do we start to reconcile that? So on to slide 23. I fully recognize over the last half hour, I've asked an awful lot more questions than I have given answers. And part of this is because this is a project that's still ongoing, pardon me. But also I think it's because I'm not entirely sure we can generate the answers at this point. And this idea of whether eating can be a risk-free activity is a really interesting sort of philosophical debate. But to me, much more practically, it has real bearing for what we do in our particular domain areas. So if I'm going to continue to look for example, effective interventions for foodborne disease, it in some ways behooves me to think about how what I might be proposing could have negative impacts for food security, for allergy, for obesity, for other food health outcomes. And I would like, at the end of this, to hear from you. Are there current policies or public health practices that could benefit from being assessed using this kind of systems lens? Recognizing, of course, that in doing so, we may be venturing into ways of doing things that don't fit nicely with the current sort of organizational and other structure that you might have to work within. But I guess I did want to sort of, table this question, and sorry, no pun intended with the table reference. Before I open up the floor to questions, what I'd like to do is just acknowledge on slide 25 the funding sources for the project. So this research is funded by the University of Waterloo through their Chronic Disease Prevention Initiative from the Propel Center for Population Health Impact. And we were fortunate to have some support from the Hallman Undergraduate Research Fellowship as well for one of the collaborators on the project, one of our undergraduate students. I'd also like to thank, although they're not named here again on the slide, all my co-investigators on the project. And it's been a very interesting experience to start to talk to people from these other domain areas and see where, something that someone is really jazzed about as an awesome solution for their problem, someone else goes, oh my goodness, hold on, that could create big problems for me. So on that note, I'm going to unmute everyone on the phone.
The conference is no longer in lecture mode.
And I will open the floor for questions and comments. We have folks on the line who, both Adobe and on the teleconference line, that can just ask their questions out loud. And for those of you who, oh, sorry, I'm sorry, I have to follow the directions here. Please enter your questions in the chat window if you're on Adobe, and if you're on the teleconference, please feel free to ask your questions out loud. Thank you very much.
Thank you, Shannon. So we'll open the floor up to people in the room first. Does anyone want to comment? Lauren, could you come up to talk into the microphone here?
Hi, Shannon. Thanks for that great presentation. I was interested in your 5 drivers, and I think I might have an issue that could potentially touch on all 5, and one that I'm working on in the back of my mind right now. So my understanding was you're interested in micro issues, toxo issues, allergen issues, for food security issues, and obesity.
That's right.
And one of the things we're concerned about here is there's a lot of medicinal natural health products, specifically medical marijuana products, that are being ingested by people from a food security sense are probably most at risk in the population. They can't afford to get medications. They take these products, but of course they're illegal. So the source of the medicinal ingredient, we're not sure about issues with pesticides or herbicides. Dosing is a huge issue, especially when people are buying it for their children. So they're not sure if they're getting too much or too little of the chemical. And then, of course, there's micro issues. Food safety inspectors are not actually legally permitted to work on the issue. Yeah, there's just a whole variety. So I wondered if that could be something that you could look at, especially in terms of policy that's negative. And if it was to be changed, would it result in an improvement? Thanks.
Thank you so much. And actually, sorry, can I just get your name and where you're from?
My name's Lorraine McIntyre. I'm a food safety specialist with environmental health here at BCCDC.
Perfect. Thank you. And of course, no one can see me sitting here in my office writing madly with these suggestions. So yeah, no, I think that's exactly the kind of suggestion that we're looking for. So, well, everyone's heard enough of me talking, so maybe we'll just go on to the next question, but thank you.
Thank you. Do we have any other questions from in room? Tom Kozaski has a question for you, Shannon. He's coming up to the podium right now.
So, thank you, Shannon. I'm not, first a question. I'm not sure how you developed your net. That to me wasn't very clear where the inputs were to have all of those lines that were part of your net. But I know that cannabis cookies notwithstanding, cannabis cupcakes notwithstanding, that not eating is certainly a risk. To reframe your title, but there are a number of other issues that I think that we've dealt with that could be brought up. One of them is peanut-free schools that fits a lot of these sort of pro and con stances. Gardens on vacant lots on busy streets, which is a common issue in Vancouver because there's certainly safety issues there that are there. There are also issues of contamination of soil and ongoing airborne contamination, as well as contamination of those people's, as well as exposure of those people working on their gardens to ongoing pollutants from trucks, etc. And then there's the sort of the modern equivalent of poor farms. And I only thought about poor farms because of a discussion I had with my daughter about something we saw 30 years ago in Nova Scotia, the remnants of a poor farm. And that's also a Vancouver phenomenon where they set up, again, in vacant lots, gardens, which are tended or supposed to be tended by people with limited means, and where the food is either diverted to local groceries for payment or where people can pick up the harvest. And it's considered a food security mitigating kind of an issue. But again, there can be stigmatization involved. There can be other issues of, is this the most healthy alternative, etc. So those are a couple of things where on face value, they might appear to be particularly useful, but they, I think, can also have significant negatives that can be mitigated. And then the whole issue of locavorism is really worth looking at, and people have commented on that before, is should we be encouraging local food to the detriment of lower costs and sometimes better controlled alternatives that kind of involve long distance shipment, but sometimes in fact incur fewer energy costs than what we can produce locally. So I mean there are a number of issues that come up that are certainly can be assessed using your framework. But the first question is really explain a little bit more how you developed the basic framework.
Absolutely, yeah. So that spaghetti diagram, basically what we did is we identified similar diagrams in the different areas in the literature, and literally, mapped, overlaid them, right? So if a paper on, foodborne disease identified how climate change could impact kind of microbial contamination of food, and another paper laid out a diagram showing how climate change could impact food security, then we basically took those two pathways and put them together. So practically, it involved a very large wall with multiple sheets of paper stuck up, and the causal diagrams in front of us, and we went through sort of one by one and merged them by picking out factors that were common and then laying those pathways out together. Does that answer your question about the method?
Validated. So, it can be a GIGO issue that if you're dealing with a net which is just somebody's idea, if you put together 6 of them, it doesn't necessarily make them better. So how can you be sure that in fact there is a sort of a real pathway in the final net that you develop?
Yeah, and we've had lots of discussions about how and if we should do quality assessment on the papers. And to be honest, I'm not sure how we would even do that, right? It's not like we're dealing with equivalent study designs or a continuum of study designs where we could prioritize, this study design yields higher quality evidence than that study design. So what we've decided to do is limit the literature to peer-reviewed literature, which, fair enough, does not guarantee that it's quality evidence, but also limited to review articles that are putting these things forward because the authors have reviewed the literature. So they're not commentary type papers. I mean, I am more than happy to hear suggestions or other people's experiences with trying to assess quality of this kind of evidence. I lean toward pulling it together anyhow, because at that point we can actually go back and try to substantiate the pathways with primary studies, for example, or or in putting it out there, then people are able to sort of argue for or against whether these pathways actually exist. But again, the biggest challenge I've heard from people is they accept the principle, or they accept the idea in principle, but just have no way to move forward without something concrete to work with. So you've identified something we've struggled with. That's absolutely for sure.
We have another question for you here, Shannon.
Hi, it's Emily Newhouse. Thanks for your presentation. Very interesting. I had a question about the scope of your causal diagrams. So obviously causal diagrams are quite intricate, and you can break down sort of mediating factors. Like if I look at the relationship of socioeconomic status to obesity, I can say, okay, well, socioeconomic status, I know it's a risk factor for obesity. And then here are the various mediating pathways that might travel through, because obviously just because I have a certain income, that doesn't mean I'm obese. That operates through certain behaviors or actions or environmental factors. And then if I go backwards from socioeconomic status, well, I can look at all the reasons why I might have a particular socioeconomic status. Look at bigger economic policies or the economic conditions where I'm living or things that cause disparity. And so in any causal diagram, you can have a variety of level of detail. You can focus in on certain mediating factors. You can go back very, very far. So I guess my question is, how are you guys setting the scope for those causal diagrams? Because I know when you're bringing from together different causes across these different 5 areas of interest, the research might have different areas of focus in terms of intermediate factors or far approximate or very distal factors. So I'm just kind of wondering your thoughts on that.
Yeah, and that's absolutely the case, right? So the foodborne disease literature, for example, tends to be much more proximate. There are not a lot of published articles talking about the broader drivers, right? So talking about the role of NAFTA in creating foodborne disease issues in Canada, for example. Whereas with the obesity and food security literature, it's almost predominantly at that higher level. Definitely sort of on the food security side with what the particular papers we've assessed. So again, for this first pass, the plan is to basically look at this map as a compilation of the state of the evidence that's been published, recognizing that this particular literature tends to focus on proximate causes and this particular literature doesn't. But our other sort of desired / intended outcome for this eventual model is that it'll be a starting point for conversation for people to come together and even think that they should talk to each other. So, where you might not have seen a link between allergy and foodborne disease before, now as you're getting ready to put a national allergy policy in place, perhaps you might think, okay, let's consult with the foodborne disease people. So again, it's absolutely not intended to capture the all the pathways in all the detail, but more to suggest that there are ways that these things are interconnected, and let's start having some conversations with people we don't typically have conversations with. But it is a very diverse set of papers that we've got. This is systems diagram producing despair phenomenon, actually, that happened for us when we looked at what was out there, but decided to barrel ahead anyhow.
Hi, Shannon. Lorraine's wondering how many papers?
For the image that I showed you, we had 31. For the full assessment that we're doing, we're sitting at about sort of 300. Most are in kind of the obesity food security realm. there's quite a bit fewer on the foodborne disease and toxicology side of things.
Thank you, Shannon. Do we have other comments or questions from in room? Okay, so I guess I'll open up the floor to people in the Adobe Connect room. If you have questions or comments, please type them into a chat window. Or if Shannon, if you could also invite people in a teleconference line to offer their comments or questions.
Perfect. Right. So for those on the teleconference line, we're open for questions now, and I'll be alternating if I need to between questions on the call and questions in the chat room. All right, at this point, is there anyone on the teleconference line that would like to ask a question? Please feel free to pipe up now.
So I guess
all right, well,
aren't
no, I was going to say either that or they're on mute, so that's great. Any questions in the chat room? And of course, if you have further questions that come to you, please feel free to contact me. My contact information was on the previous slide, and I know that Tina has the slides and can make them available. And I did want to also say thank you for the suggestions about the policies that we might explore, and these are consistent with what we're hearing from other fora as well, both from public health practitioners, as well as the kinds of things that the different researchers are seeing in their own research areas as issues that people are either grappling with or really pursuing.
Thank you so much, Shannon, for the great presentation. Just a reminder to attendees, if you're joining as a group, please send me tina.chen@bccdc.ca an email to confirm your attendance for educational credits if you do need them. And thank you for joining us today. Have a great day.
Thanks very much, and have a good holiday, everyone.